My God, I hate drugs.
The country's third telco, Mislatel Consortium, hurdles a major roadblock. This after Senate allowed the transfer of ownership of a firm that's part of the consortium. Our Joyce Ilas tells us the details.
Despite alleged violations to the terms of its franchise, the Senate clears the way for Mislatel to operate under another owner. It adopted a resolution allowing the transfer of Mislatel's controlling interest to a consortium, which government earlier named as the third telco. The ownership transfer and subsequently that of the franchise was a major hurdle for the consortium to operate as third telco. The consortium is composed of Mislatel, Davao-based businessman Dennis Uys Udena Corporation, and its unit Chelsea Logistics Holding Corporation, and Chinese government-owned China Telecom. Senators Franklin Drilon, Panfilo Lacson, and Rizzo Ontiveros opposed the measure.
Clearly, that would weaken the power of Congress insofar as monitoring compliance with the privilege granted, with the conditions imposed on the privilege granted.
During the plenary debate, Drilon argued that Mislatel's franchise has been automatically revoked because of a number of violations. First, it failed to operate within a year after it received its franchise in 1998, and it failed to offer 30% of its outstanding capital stock to the public within 5 years from the start of operation.
The non-operation, Mr. President, does not prevent them from complying with the dispersal of ownership.
Hindi po, wala lang pong bibili.
Ha?
Wala lang pong bibili.
Hindi naman po kailangan may bibili. Ang importante yung i-offer mo. They again is in violation of Section 16.
They did not comply with Section 16, Mr. President.
Drilon adds Mislatel violated again its franchise for failing to seek congressional approval when it transferred about 75% of its shares to its new owners in 2015. Senate Public Services Committee Vice Chairman Francis Escudero, however, pointed out that the committee does not consider the franchise revoked.
The committee took the position that in only one of two ways can a franchise lose effectivity. One would be by the filing of a quo warranto proceeding, or two, Congress at any point in time voting to either revoke or repeal the franchise granted for violations of the provisions thereof.
The Senate's decision avoided a possible rebidding for the third telco and back to square one for the selection committee in finding ways to improve the quality and affordability of telecommunications service.
Samantala, isang batang babae ang nalunod sa Manila Bay kahapon habang nagsiswimming. Makikita sa video ang bata habang inaalalaya ng mga otoridad na ilagay sa isang stretcher. Nakapaligid din sa kanya ang iba pang mga bata na tila kasama niyang naligo sa tubig. Sa pahayag ng Manila City Administrator, kinumpirma ng tanggapan na naging kritikal ang kondisyon ng bata na isinailalim sa Pediatric Intensive Care Unit. Sa ngayon, may malay na umano ang 11 taong gulang na batang babae. Kasalukuyan siyang ginagamot sa ospital ng Maynila. Babakuran ng ilang bahagi ng Manila Bay para mapigilan na ang publiko sa paglangoy doon. Nauna nang pinaalalahanan ng Health Department na madumi pa rin ang tubig sa Manila Bay. Makibalita tayo sa aming correspondent na si Caroline Bonquien. Caroline?
Pinky, kumpara sa dami ng tao dito kahapon at nung weekend ay halos walang tao dito sa may pangpang at tubig ng Manila Bay maliban dun sa ilang mga naglilinis. Mas mahigpit na kasi yung pagbabantay ng mga government agencies dito gaya ng DPWH at MMDA. Meron na ring mga signages at barrier na nakalagay para nga pagbawalan yung mga tao na buwaba doon sa tubig. Ngayong araw ay sisimulan na rin yung paglalagay ng bako dito. 1.5 kilometro ang haba mula dun sa Manila Yacht Club papunta sa US Embassy. Ang sabi ni Environment Secretary Roy Simatu, hindi naman nila pinagbabawalan yung mga tao na pumunta dito sa Manila Bay. Makikita pa rin nila yung sunset. Dito nga lang sa may kabilang bahagi ng bako dito sa kinakatayuan natin at bawal lang sila na mag-over the bakod. Mahirap nga naman daw kasi na naglilinis sila tapos merong mga naliligo sa paligid. Bukod pa dyan ay delikado sa kalusugan ng mga tao dahil mataas pa rin yung coliform o E. coli bacteria level dito na nagiging sanhi nga ng mga sakit gaya na lamang ng diarrhea at skin rashes. Ngayong buwan ay sisimula na rin ng DPWH yung paghuhukay o pag-aalis ng mga burak dito sa ilalim ng Manila Bay. Ang sabi ni Undersecretary Sherwin Rigor ay nasa 2 hanggang 3 metro ang lalim ng ang taas ng mga basura na naipon dito sa ilalim ng Manila Bay at aabutin nga ng 1.5 taon hanggang 3 taon bago yon maalis. Nilinaw naman ni Secretary Simato kanina na wala pang inaaprubahan talaga o may go signal na reclamation project kapag magkaroon daw ng conflict sa pagitan ng Manila Bay Rehabilitation at isa dun sa mga reclamation project ay papanigan ng DNR at ni Simato ay ang Manila Bay Rehabilitation.
Election officials counting votes for the second Bangsamoro plebiscite. Hundreds of thousands voted on whether 7 towns in North Cotabato and 6 towns in Lanao del Norte will be included in the new Bangsamoro Autonomous Region. In Lanao del Norte, officials there say the plebiscite has been smooth despite bombings yesterday. They also expect at least 70% voter turnout. Our George Cahiles has more.
Authorities say explosions in Lanao del Norte on Tuesday was just meant to sow fear among voters. But in Barangay Maranding, Lala Town, despite the blast several meters away from the school, voters still chose to cast their ballots.
Then pagsabog kahapon, para bang nagalit talaga ako. Yun bang para pananakot ba? Itong lugar ito sa amin yung lugar na ito. No, bakit kailangan pang takot-takutin? So ganyan ba? So that's why I vote.
PNP Chief Oscar Albayalde himself checked the security in place after the explosions in 3 towns on Tuesday. No one was hurt in the 3 separate incidents. So far, police say there are already persons of interest in the bombings, and they also think a group is behind them.
We strengthen our checkpoints. No? Kung talagang gustong lumusot, talagang lulusot eh. Kasi napakalawak yan. Remember, the checkpoints are only established along the roads.
While most residents are confident of a peaceful conduct of the plebiscite, they fear that atrocities might happen after the polls.
Kung pwede sana manatili sila, no, even after the plebiscite, but then we are also confident that may mga, even our governor also, no, i-secure naman nila kami.
If the commander on the ground, especially so the PD, will see na hindi pa medyo tense ang they can always request for additional forces.
Meanwhile, the military believes the Moro Islamic Liberation Front will abide by what they have agreed on. Despite the latest video of Commander Bravo instructing his men to go down from the mountains, they will just stay in agreed areas far from the town centers. Congressman Abdullah Dimaporo is confident residents will not allow the division of Lanao del Norte.
Pero yung nakita natin na movement nila is just a movement from their staging area. Mayroon din kasi tinatawag sila na staging area. At we have agreed na hanggang doon lang muna sila. Unless otherwise, mayroon tayong mga coordination na gagawin.
Ako po, hindi ako naniniwala at walang maniniwala na matatalo rito ang no. Kung manalo man ang yes dito, ang gagawin po, katulad na nangyari sa Cotabato City na binilang yung yes plus the no, ang lumabas po ay mas marami yung grand total kaysa sa dami ng registered voters. Sana po hindi mangyari yan po sa amin.
The MLF meanwhile promised that they will respect whatever will be the result of the plebiscite in the province, provided the exercise is carried out fair and square.
A measles outbreak declared in Metro Manila. Health officials say there are more than 800 suspected cases in the region, with at least 55 confirmed deaths. This comes in the wake of reports that parents refuse immunization of their children because of the dengue vaccine controversy. Makoy Popioco joins us live from the Health Department in Manila. Makoy, can you tell us more about this?
Ruth, the director of the Health Department's Epidemiology Bureau, Dr. Chito Abelino, says the outbreak declaration was necessary because the most recent number of measles cases in Metro Manila has already exceeded the average number of cases in the last 5 years. He adds he has also recommended the declaration of a measles outbreak in some regions, including Central Luzon. And Health Secretary Francisco Duque is expected to make an announcement on this soon. While it is still finalizing the most recent data, the agency has observed an uptrend in the number of measles cases in the country in the last 2 years. From January to March last year, there were more than 2,400 suspected measles cases in the country, with 8 fatalities. That's for the first quarter of the year alone. And that number is more than 200% higher than that of the same period in 2017. During the first quarter of last year, most confirmed measles cases were recorded in Mindanao, with 370 cases. And this is a significant spike because in 2017, Mindanao had 6 confirmed cases only. The National Capital Region had 26 confirmed measles cases in the first quarter of last year. Again, this is a notable increase because in 2017, Metro Manila did not have any recorded measles case at all. What is to blame for this sudden surge of measles cases in the country? The Health Department found out more than half of the measles cases in the first quarter of last year were among those who have not received vaccines. A great majority of these cases without vaccination involve infants aged 4 years and below. What to do now that there is an outbreak? Let's listen to Dr. Avelino.
Iwasan muna natin pumunta sa mga matataong lugar kasi maaari doon natin masagap. At kung kayo ay hindi nabakunahan, prone kayo to acquire the infection. Have a healthy lifestyle. So eat well-balanced diet, have plenty of rest, don't smoke, have exercise regularly. At the moment, please, if you have children who are not yet vaccinated, please get themselves vaccinated.
Those who want to get vaccinated can go to the nearest health center or government hospital. The vaccination or the vaccine is free. And Avelino adds they are also thinking of organizing vaccination drives around the country soon. Ruth.
Makoy Popyoko reporting. A measles outbreak also declared in Central Luzon. The health department says more than 400 cases of measles have been recorded in the region since January 1st, with 1 confirmed dead. Let's now get more details from Health Assistant Secretary Eric Tayag. Good evening, Dr. Tayag, and welcome to Newsroom.
Good evening, Ruth.
Sir, so itong outbreak, which areas? Metro Manila and then Luzon. Can you tell us about yung other places kaya, sir?
Okay, there are other regions that may experience increase in the number of measles cases. These are to be expected, Ruth, because the measles virus started to circulate in the country in the colder months, that was in December, and will continue to be transmitted to vulnerable populations, especially children, which did not get their vaccination against measles. Now, for the public, I watched the report earlier. Vaccination will really save lives, especially that 55 deaths were reported recently.
Pero sir, yung areas na sinasabi nyo, aside from Metro Manila and Central Luzon, may iba pa ba kayong areas na mataas yung measles cases?
Right now, we are verifying, Ruth, because we don't want to make pronouncements that the outbreak is region-wide. In fact, there will be updates wherein the outbreaks will be pinpointed to barangays or cities if, in fact, these outbreaks are recorded there.
Okay. Doc, pa-address lang tong concern na tama ba na kasi yung na-mention kanina sa report ni Makoy, na kasi natakot yung mga magulang na magpabakuna dahil doon sa nangyaring controversy dito sa dengue vaccine. 200% increase in cases in the first quarter of 2018?
It might have contributed, but there are other factors because for many years we only have enough vaccine coverage that will not allow us to eliminate measles in the country, and so therefore the number of susceptibles accumulate. That will explain why there will be outbreaks. That's why the Department of Health implemented supplemental immunization activities to catch up on children who missed their doses when they were still at 9 months to 18 months. That's what's happening. And there are many reasons why the measles outbreak is happening now. And the primary reason is that not enough children are getting vaccinated.
Yun nga po, so mas konti yung nagpapavaccine ngayon. This is yung ganito kalaking increase over the past few years. Ngayon lang po ito ulit nangyari.
Yes, that's true. And it's not only in the Philippines, other countries as well. And there have been announcements that vaccine hesitancy, where there is fear for vaccination, that is one of those that influence the low vaccine coverage. But we've seen in many areas that are not experiencing outbreaks, the vaccine coverage remains acceptable. And so, therefore, it's not a general rule that everybody fears the vaccine. There are those who still have faith in the vaccines that the Department of Health routinely gives.
Okay, Dr. Tayag, ano na lang pong apelan nyo sa mga magulang ngayon? Hanggang anong age po ba pwedeng magpabakuna against measles?
Okay, the measles vaccination, nag-start po yan ng 9 months. Inuulit po yan 12 months to 18 months. 9 months, pwede na po mag-umpisa. Ngayon po, dahil may special immunization activity tayo, supplemental, pwedeng hanggang 5 taon. Lalo na sa outbreak, baka dagdagan pa nila yung edad kung saan pwedeng magbigay ng bakuna. Ayun na rin sa record po nila at kung yun po ang mga kasong nakikita nila at kung meron pa pong supply ng measles vaccine. Sapagkat katulad ng ganito, may outbreak, tataas po demand dyan. So ang pakiusap po natin sa mga local government, baka tumaso yung demand dyan. Sa weekend sana ay manatili silang bukas para dun sa gusto magpabakuna ay mabakunahan na po kagad.
Doc, yung bakuna ho, sure po ba to na hindi babalik yung measles or?
Lifelong immunity. So,
okay, lifelong immunity. Okay.
Nagkasakit ka ng tigdas, hindi na maulit yan, o nabakunahan ka, yan po ay protection nyo na habang buhay po.
Again, Doc, reminders dun sa mga anong pwedeng gawin para maiwasan to, lalo na yung hindi pa nabakunahan po, Doc?
Okay. Bakuna lang po talaga ang magiging pinakamainam na prevention po natin dyan. Yung magkakatigdas po, para hindi naman po nagkakaroon ng komplikasyon, ay kailangan patingnan nyo po kagad dyan. Magsuspecha po kayo dahil sinisip po na yan, inuubo, namumula mata. Mataas yung lang natin, hindi bumababa, lumalabas yung pantal sa noo, pababaho yan. At magkakaroon ho ng diarrhea, bronchopneumonia. Sa ospital ho, nabibigyan niya ng gamot, kaya pangkaraniwan po, tinatakbo na sa ospital yan. Pababain niyo ulag na sapagkat tumitirik yung mata niya, nagkukumbulsyon din po. So, para maiwasan po itong mga binanggit ko, yung pagpabakuna po talaga ang importante.
Okay, basta yung mga may ganyang symptoms, Doc, dadalhin na lang po agad sa ospital at may gamot naman yan ang sinasabi niyo.
Dadalhin po yan at yan ay mabilis makahawarot. Sa isang kaso, siyam hanggang 18 pwede pong mahawa.
Through ano po ito? Paano nahahawa, Doc?
Airborne po yan, airborne.
Airborne,
So,
okay.
highly contagious. So, sa bahay, may isang may tigdasyon at wala pa nagkakatigdas doon sa bahay at hindi naman nabakunahan, lahat sila magkakatigdas po.
Ano pong susceptible na age talaga usually?
Mga wala pang 12, wala pang 2 years old. Sa ngayon po, ang namomonitor natin, mga bata po, less than 10 po.
Doc, yung elderly ba pwede pang mahawa sa ganyan?
Pwede po, pero pangkaraniwan mga bata. Yung mga elderly po, pailan-ilan po yan, sapagkat kadalasan po, kaya hindi natin nakikita sa elderly, malamang sa hindi, nagkatigdas na po sila nung bata-bata pa po.
Okay. Thank you very much to Dr. Eric Tayag. An urgent plea from pediatricians across the country. In a joint statement, the Philippine Pediatric Society and the Pediatric Infectious Disease Society are calling on parents to have their children vaccinated. They reiterate the importance of vaccination in preventing the spread of infectious diseases like measles. They also call on members to step up efforts to encourage patients to get immunization.